Namaste, and welcome to a very special series on homeopathy and other subjects on a very special hospital and a very special guest that Dr. Phansalkar has brought, Dr. Shirish Phansalkar. Namaste, sir.
Namaste.
I've read the article that Dr. Phansalkar sent me, and it is so fascinating that there could be a hospital in India that would be allopathic and allow at the same time Ayurvedic and homeopathic. How did this all come about, sir?
Actually, initially, the doctors from the hospital, they experienced what is the use of homeopathy. Personally, they could see that there is some benefit of alternative system.
And these were allopathic doctors.
Allopathic doctors. And even the trustees, means late Lata Mangeshkar and the Mangeshkar family, they were also strong believers of alternative systems. They wanted to support other systems also under one roof. That is how the idea came. And then they started homeopathic department, then Ayurvedic department. Now they have started even the yoga department. So all departments are run under one roof. And now recently they have started even the interdisciplinary research.
When did it first begin, this hospital, or this work?
The OPD started some time back, about say 15 years back.
Oh.
Yeah.
Now, I've been told that you had great success with COVID patients. Could you enlighten us on that?
Yeah. It came as a great challenge and opportunity both. Because initially in the first COVID wave, there were symptoms which were not responding to any treatment, because even the medical world was at a loss to really understand what the thing is. And there were mainly symptomatic treatment initially. So in that symptomatic treatment, the fever, body ache, weakness, and in the second wave, the respiratory complaints, the cough, breathlessness. These were the prominent symptoms which were not responding to a conventional treatment. Conventional, I mean something which was a protocol at that time. So what we asked the allopathic doctors over there, the medical director, that is it possible for us to treat along with you, because at that time nobody would allow even only homeopathy or only Ayurveda. There was a protocol that the conventional allopathic treatment will go on, and along with that, if you want to try something, you can do. And they were not, the entire world was not ready to take a risk at all, because the pandemic was so overwhelming at that time. So they did not want to try anything at that time. So the condition was that along with the conventional treatment, if you want to try, then let us see. So that is how we were given permission to start treatment. But the condition which was put to us, that you are going to come in the wards. You are not going to sit at home and then advise. You have to come to the wards, you have to see patients, and then only you can start treatment. They were also trying to see whether how far we are ready to take challenge. So we said, okay, let us see. At least something we can do. If it is in the benefit of patient, let's do that. So then my organization, Dr. M.L. Dhole Memorial Trust, that is my organization. The trust name is Dr. M.L. Dhole Memorial Trust. I am one of the trustees of the organization. It is based in Palghar. And we are running its activities in Pune also. And in Dinanath Mangeshkar Hospital also we are running the activity. So a team of doctors was with me at that time. So what we decided, because due to age, I was not allowed to enter the ward.
Ah.
And then we had to go to ward in case we have to treat. So I asked my colleagues, students, that this is something which we have to do. This thing comes once in lifetime. Either you have to prove yourself or perish.
Mm-hmm.
So,
May I ask, what was the conventional treatment at that time?
conventional treatment was mainly treating fever and symptoms of body ache and weakness. At that time, there was no conventional treatment or no specific protocol, because everything was going under the study per se. So what we asked them, that when you are treating, if you are giving treatment for a couple of days, if there is no change in the symptoms like fever or body ache, is it possible for us to start treatment?
Ah.
So then they said, okay, you can try that. And that is how my colleagues, Dr. Tejaswini and Dr. Navnath, they entered the ward with all the PPE kit.
And they were younger to you?
Yeah.
So they were allowed to enter?
Yeah. And then I had to give a telephonic consultation, because they were in wards. They used to call me that this is the situation, what to do. So this was sort of a situation.
And can you take us through the methodology you used in homeopathy to help them?
Yeah. Because that way, I've been practicing homeopathy for last 35 to 40 years. So usual cases of acute fever, acute viral infections, we have been treating in practice. And there was hardly any literature available or guidelines available to treat COVID at that time. So we took help of certain books where certain guidelines were given for treatment of fevers. And then our own experience while treating fevers. So that is what we tried to, that was the methodology which we designed. And there is nothing like that in case there are 10 patients of COVID, you have to give same medicines to all. Because homeopathy believes in individualization.
Yes.
And in individualization, because even if there is fever in 10 individuals, their response to fever at emotional level, at physical level, is different. And that is where actually homeopathy chips in. That in case there are 2 patients who are having fever, but one is very, very nervous with fever. Second is weeping constantly with fever. So these are 2 different responses to fever. And that is how there are different medicines in homeopathy for that.
Mm-hmm.
So that was the basic principles on which we decided to go ahead. And initially, after a few days, then we started interacting with the infectious disease specialist also there. They were treating. So initially, as usual, there was a resistance. But they also started seeing that, yes, now if the patient is not responding for a couple of days, after starting our treatment, if there is a definite difference, then let us try this.
They would open up.
Yeah. Mm. And with this, then we got some courage to do a research.
Yes, yes. So how did it work with the first patients?
First patients means, as a science, we got results in 80 to 90% of the patients. And that is how we dared to go into a research module. And the specialty of COVID was that you don't have time to treat. So you have to give results within 24 hours. If there is no change in the symptoms within 24 hours, then we were forced to think that whether am I right in prescribing the remedy or I have to change. That was a good and big challenge.
Mm-hmm.
So we learned maximum during that time, that what can be a different type of presentations of fever, acute medicines, then what different strategies we need to do. And after 2 to 3 months of such treatments, then we presented a protocol of research to the medical director of Dinanath, that we want to run a pilot project. So he also said, okay, we can treat this as an adjuvant therapy research protocol.
Interesting.
And we said, okay, it's okay. Then what we told him, that let us study 100 patients. And because the number of patients, the quantity wise, there was no problem in getting the patients, because the hospital was overfull.
How many beds in the hospital?
500 beds for COVID.
500 for COVID.
It's actually 1,000 bedded hospital, but one entire section of 500 beds was for COVID. So that is how means as far as the quantity of number of patients, we never had any difficulty.
So you began with 100?
Yeah. And in that protocol, 50 patients were put on homeopathic treatment and allopathic treatment. And 50 patients were put on allopathic treatment and placebo.
Huh.
And then the results were given to a statistician, qualified statistician, medical statistician. And the statistician analyzed the result. And those we shared. Those things I shared in the article, which is given as an article, where the symptomatically there was a drastic change. Oxygen requirement in second wave, which was a very, very difficult situation. There were no oxygen cylinders also sometimes.
Understand, yes. I've read a lot about it.
So during that time, the oxygen requirement with homeopathic medicines was drastically reduced. That is what we documented. That these are the patients which are on homeopathic treatment. And see, within 2 days, the oxygen requirement has come down drastically. Then another criteria which we decided was the hospital stay. Whether the hospital stay is getting reduced or it is remaining same. Because during that time, even the hospital beds were not available. So the oxygen requirement, hospital bed, these were very useful for even the community at large.
Surely. How many of the 50 on a placebo did any better?
Placebo, the requirement of oxygen did not go down. And the hospital stay was more or less same. And I'm very glad to share that after seeing these results, the hospital, Dinanath Mangeshkar Hospital and my trust, they decided to have a sort of a collateral or a collaborative research on
Homeopathy.
with homeopathy and with a specialist in allopathy. So now we are conducting research on hypothyroid. Then we are now the next in line is the role of arnica in reducing the agony in chemotherapy patients. So it will be with the help of a super specialist, and it will be in a proper research protocol.
How would this differ from the soluble marijuana treatments for pain?
See, mainly the research protocol or research methodology is not different. It is just the same.
Huh.
But now the result analysis or evaluation will definitely point out in what way it is making a difference. Because right now, nobody is venturing it into only putting it on homeopathy. Still, it is a sort of a adjunct therapy.
Mm-hmm.
So after a couple of research projects, then possibly it will be possible for us to conduct research only with homeopathic medicines. Only homeopathic medicines and with placebo in a different group.
With placebo, okay.
So initially we can start with homeopathic medicines. At the same time give placebo to another lot. And after some time you cross over. You give placebo to those patients who are receiving homeopathy and then homeopathic medicines to those and then compare. That's what we are planning to do now.
So it's in its initial stages.
Yeah. Initial stage of acceptance.
Yeah, of acceptance, yes, yes. Could you tell us, Shirish, a bit about this hospital, its background and how it was formed and...
About the trust?
The hospital.
Hospital, yeah. Actually, the hospital was the idea of late Lata Mangeshkar. So, she had a desire to do something for the poor people. And those people who really require medical facilities. And if those facilities are not available, they should not go back. And similar idea, my teacher, Dr. M.L. Dhode, the trust is named after him. He was my teacher. So his idea was also that the patient who comes to your clinic should not go back only because he doesn't have money. You have to treat the patient. So I got somewhere the ideas were matching of the trust and of Lata Mangeshkar Foundation also. That is how it started.
Wonderful. Can you take us back to when you first began to study homeopathy and give us a timeline?
Usually during that time, homeopathy was a backdoor entry to practice allopathy.
Interesting.
Because if you did not get admission to allopathy or MBBS, then people used to go to either Ayurveda or homeopathy and then switch over to general practice. That was the trend which we had. At that time, I did not get the adequate mark. It was 1 or 2% less than the admission for MBBS. I was down with enteric fever during that time, so I could not really perform to the expectation of getting admission in MBBS. So then my family doctor told me that it is not the end of the world. You can, if you have talent, you can go to other systems and try. Basically, you want to do it because you want to help people. So that is how I went to homeopathy as a negative vote. That I did not get here, that is why I went there.
How old were you at the time?
I was around
18?
16, 20, 21.
20, 21. Oh. So, please continue.
And then my family also supported me greatly. Because homeopathy was not very much known at that time. So, nobody was sure about the future.
In India, you're speaking especially.
Yeah, particularly in that part of Maharashtra, Pune. There was a college, but most of the people, they used to practice allopathy after getting, say, certificate or diploma. Incidentally, my grandfather from my grandmother's side, my father's mother's side, he was a lay homeopath. And that was his passion. And my relatives used to tell me that people used to believe that if nothing is helping, go to him. And indirectly there was the family support also.
You knew him well?
No.
Not at all. Not at all?
I had seen, but I did not recollect properly. And at that time, homeopathy was just a sweet pills for me.
So how did it evolve?
And later on, then one thing which I had decided that whatever we are going to do it with sincerity. Do it with full commitment. And my colleagues used to tell me that there is no future because most of the people, they used to come from rural Maharashtra. So they used to say that when we are going back, then we have to practice allopathy. There is nobody knows homeopathy in the outskirts of Maharashtra. So they were right from their side. But I had told them that no, let me see whether I want to practice homeopathy. Whether the path is right or wrong, let me prove it. So I decided that let me learn what is in the pathy. And after our licentiate, at that time there was LCEH degree. There was a licentiate course. There was not a degree course also at that time. After doing that, then I was told that 2 or 3 MD doctors, allopathic doctors from Mumbai, they are practicing homeopathy. So I was a bit surprised. So I thought, let me find out. And incidentally, my father was posted in Mumbai at that time. So I went to Dr. Dhole, Dr. M.A. Dhole. He was MD medicine, and his father was also MD medicine. So his father actually started homeopathic ward in Sion Hospital at that time.
What year was that, approximately? What year?
Let's see, 1970s, 1950, 60.
50, 60.
Yeah.
And who were your teachers?
Dr. M.L. Dhole. He was also MD medicine. And so that is what helped me also, that basically if you want to practice homeopathy, you must know basic sciences of allopathic medicine also, or allopathic science means your clinical medicine, your gynec, surgery. You must know that. If you know that, you can practice other systems very well. So actually, he was my mentor. And his work schedule was 6 o'clock in the morning till 10:30. Means till the last patient goes. So that is the way in which he taught us.
And you were with him during that time?
Yeah.
Wonderful.
And then I developed confidence also in the system, that yes, this system can do something better. I can have also a better future in life. So I was with him. And then since I was based in Pune, after 2 or 3 years, I had to go back. So he told me that you are not going to go back without anything. You have to start this activity in Pune. And that is why I started that activities in Pune also. And gradually then it started.
How did you meet our beloved Dr. Phansalkar?
He was my classmate.
In the school.
He was my classmate in the school.
Oh.
And then after my graduation and after my training in Mumbai, then I was told that we have to conduct a camp, homeopathic camp in Ambejogai. Dr. Phansalkar was practicing there at that time. So after talking to each other, then we actually we talked after some years, no. And then see, I was practicing in Pune. He was practicing in rural areas. That is more difficult.
Yes.
And then in his family, even his brother was practicing veterinary science, practicing homeopathy in veterinary.
Oh,
That is how our common interest started growing.
interesting.
We were benchmates in the school.
How do you feel allopathy progressing?
Allopathy is progressing definitely about that. Their research, their documentation is something worth learning. And they are practicing whatever they know and they publish it, they share it. They are open about the success and failures. That is something which we should learn. And that is how I said that if it is a science, then science can grow only if you know your success and your failure and if you evaluate the results.
So you publish everything?
Lately, yes.
Lately.
Because that is our system's weakness and my weakness also. Doing work and not publishing.
When the second wave of COVID hit, how difficult was it for your team?
It was more difficult because there was more of a respiratory problem, the cough, breathlessness. And the pattern during the first wave and during second wave was different. The same line of treatment was not useful during second time. And in first wave, we were related that yes, we can conquer something. During second wave, it was challenging. And then we started really studying more of whether the same line of treatment is useful or we need to go beyond certain conventional drugs or medicines and look into some different strategies. So percentage-wise, the first wave, the results were fantastic. In second wave, they were good.
They were good?
Good.
I see.
But it opened, doors for so many things, for our learning, for the development, for progress of pathy.
Dr. Phansalkar has often talked to us about herd immunity. Can you share some of that?
Herd immunity.
Yes.
Yeah, ultimately, see, immunity is something which is now the buzzword. That rather than treating microbes or organisms, improve your immunity. Now, the immunity you may get by remaining in a flock or in a group where each other tries to share infection or disseminate the infection. And during that time, actually, your immune system gets a chance to work. So, more you are exposed to this, more you get immunity. That is the basic principle. Don't try to suppress or tamper immunity. And in herd immunity, it's a sort of, I would say, in quotes, teamwork. More people come together, so more people are helped. Means it's a sort of a risk from one angle that if more people are exposed to similar things, and if you don't know how to handle this infection, it is a risk. And if you develop immunity, then it's a herd immunity. Means the entire community or majority of a community gets immune to that
Your
infection.
benefit.
Yeah.
I see.
Partly a vaccination process is giving immunity to people at large. So vaccination is a good way. It gives immunity, of course, no doubt about it. But what the point which I am emphasizing is that vaccination also boosts your immunity, but you have to make efforts to improve your immunity. And even homeopathic medicines also help in building up your immunity. So all these three, if integrated, can give a better immunity to a community at large. That is what I was saying.
What do you see for the future of homeopathy?
Future, I am
10, 20 years ahead.
yeah. No, it will obviously acquire. Just now, it is in the state of acceptance. Now, it will go into a stage of a treatment of choice. Not a treatment where everything else is tried and let us try this
As a last resort.
as a last resort. So in 20 years, when we publish many results, when we document results, when we show research activities to public in large, we have to educate them. We have to tell them that, see, in so many patients, this is what trials which we have conducted, these are the results. People will start believing that because you have a documentation. And now people will have a choice that whether should I opt for homeopathy or should I opt for modern medicine. So rather than coming to homeopathy as a last resort or as a no choice, there can be a choice in few years.
Do you see future viral problems coming as a result of COVID or separate from COVID?
Yeah, no, viral infections will definitely be more. Because, see, in some way or the other, the antibiotics era has definitely conquered the infections by bacteria. There is a lot of development at that level. But unfortunately, that much development or research is difficult in viral infections. Because the viruses, they go on mutating.
Yes.
And that is why it throws a more challenge to your immune system. So the viral infections will definitely will be overwhelming now. And for that, as I said, the choice of treatment can be homeopathy. Because now, over a period of time, we have to share and prove it to the world that yes, this is something which we can offer. And that can be the future.
Can we talk a moment about this monkeypox?
I have just heard and seen. But
Especially in young children, I'm told.
yeah. But right now, I won't comment on that because I don't have much study. I can comment something about articles, but I need to study something more on that. But again, monkeypox is a viral infection. So in some way or the other, one virus goes, another virus is coming up. Because they are a real challenge to mankind.
We have a line from Sri Aurobindo ultimately it is faith that heals. Can you comment on that?
I think that model, or the statement which you made about the faith, that is the model on which homeopathic works. The homeopathic model of the concept of man is that there is a spiritual, intellectual, emotional, physical aspect of a man. And of course, at the top is spiritual. Now, emotional thing is that in case you take something with a positive frame of mind, now the research also indicates that there are good hormones which are released because of that. And good hormones, because that is called as psychoneuroendocrinal system. If your psyche is in a good state, because ultimately faith gives you a positive feeling that there is something or somebody to care for me, or there is a hope. So, hope gives you some positive feeling, and in that positive feeling, certain hormones are released. And those hormones definitely give you better immunity to fight with the world. There was one science fact or fiction that Vibrio cholerae, the organism which causes cholera. So when that was invented, there were two schools of thought, whether this Vibrio cholerae is responsible for cholera or it is not responsible. And there was one person who said, no, it is not responsible. It is not going to affect me. There was a solution of this Vibrio cholerae, which was given to him and to somebody else. The person who was saying that I am not going to get anything did not develop anything. That is what I have read, I have heard. So what I am saying is that if your mind is strong, mind is positive, or there is a faith, it definitely heals you. There is no doubt about it.
What do you feel about natural supplements in tablet form or powder form?
Natural supplements are required, but that should not be the only thing which should replace the healing, because it should come from your dietary sources also. Because your body is tuned to digesting those things rather than some supplements which are prepared outside. So, whenever required means if there is a deficiency and the symptoms are due to deficiency, then I would recommend that supplements are there. But that is also known that even if there is a supplement which is given, the body should be able to assimilate that.
Yes.
And that is where the homeopathy chips in. That there are certain medicines which improve your assimilation, which improves your metabolism. So, since you brought the point of supplements, now in case somebody is having a deficiency of iron, and a person is given iron, another person is having deficiency of iron, and if that person is given iron along with homeopathic medicine, the results and the speed of recovery is faster. That is what we have heard. We want to experiment on that.
Mm-hmm. Anything in closing that you would like to say about homeopathy to this large audience who watches us?
I think the COVID epidemic is a blessing in disguise for other systems. Now they have to take this challenge to really show that yes, this system also works on immune system, and the future is immune system. Let it be virology, let it be anything else. But immunity mediated diseases are bound to control us for some time. And for that, homeopathy should really work hard to do something on that. That is my.
Wonderful. Dr. Phansalkar, will you tell us personally some of your association with Shirish?
Yeah, mainly I found that this Institute for Clinical Research, is founded by a very popular allopath of that time. He was basically allopath but had very good inheritance from his father in homeopathy also. And as he was very good in pathophysiology, he used to educate his students in such a way that they were convinced, and even allopathic doctors started studying homeopathy along with Dr. Shirish. I met Dr. Apte, and they were all allopathic doctors who studied homeopathy. And we conducted first camp. It was way back in 1979-80. And we conducted one homeopathic camp in our rural area. And they were all almost 12 doctors coming from Pune and Bombay together. And each doctor was given hardly 7 cases for the day. And each doctor studied, and next day we had a workshop where doctors presented their interesting cases from the camp. And there we found out that there was wonderful, symphony. These allopathic doctors and homeopathic doctors, they were working together in harmony. And this was the beginning, actually. Because of this institute, the homeopaths and allopaths started working together, and they were speaking the same language. And now, that time, though, it was a very small institute when this was started. But now it has almost more than dozen branches, and each branch at a time having almost dozens of students studying there. And it was the first post-qualification course in India, where the qualified homeopaths used to come, and it used to be full-time 3 years course where people came, and it was really a clinical training. It was clinical. In clinic, the students were asked to work. And the best thing I found out was that each student was working hard in the clinic and working out the remedies, and I don't think less than 10 hours a day they were working, little more than that. That way, it was a wonderful experience, and I had many camps with them. We could attend many camps and seminars with the group. And basically, for me, it was a very funny thing. I turned to homeopathy because I used to go to homeopath for our medicines. And there were amateur homeopaths like Nana Sahib Marathe, you must have heard, Ramesh Kulkarni, engineers and chemists, and they were working as homeopaths. And after that, when I started my clinic in rural area, the picture was altogether different. The type of patients coming to homeopathy in city and type of patients coming in rural area was altogether different. In city, as Dr. Shirish told, that people used to try everything around, and then once failed, then they would come to homeopathy. But this was not the case in the rural area. People with any serious disorders would just barge in homeopathic clinic, because they were open to all these systems, being rustic villagers.
And poorer people.
So, yes, poor people. And they were open to anything what you give. And this was really a challenge for me. So what I did, I couldn't close my clinic and go for learning again this type of homeopathy. So what I did, I called all experienced people to our village, and I just arranged that they take the cases and we discuss. So we used to have a surgeon who turned to homeopathy, Dr. D. Mistry. Then we had amateur homeopath, Dr. Bhau Nagvamshi. Then Dr. Kulkarni, and there were people from this Institute for Clinical Research. So through that, we started learning, and there I understood that the way this clinical institute was teaching and coaching, that was wonderful, useful, very useful. So that really helped us in rural area. And now homeopathy is so popular in the area that it has become a first line of treatment.
Oh,
So in Ambajoga is a place where in India people come to homeopath. Under homeopath's guidance, they would seek experts' advice from allopathic super specialty people, but they will just implement or execute treatment under our supervision. ENT surgeons, neurophysicians, neurologists, even if they advise, they will listen to homeopath and then only they will proceed.
is it as true in the cities as in rural areas now?
In cities, the lifestyle is altogether different. So things don't spread properly in cities. They are all what we call in our term westernized people. They don't have good association. In villages, good things and bad things, they are propagated very quickly. It's like a small community. And therefore, working in rural area in a way is easy. Because once you show the results, that will be propagated very quickly, unlike cities. Cities, people are rigid, and mainly what has happened, that cities are dominated by allopathic science. And in allopathic science, what has happened, wonderful research, everything is wonderful, but because of the super specialization, there is coming a battery vision. Same patient going to ENT will have, for headache suppose, goes to ENT, he will find out something in the sinusitis or something. If the person goes to neurophysician, he will find out some migraine like thing in the brain and waves are working like that. And goes to general physician, will find out some anemia or something like that. But that totality view definitely will be very rare thing in allopathic field, because it's a rare thing. And of course there are very good allopaths we have seen, very good allopaths we have seen.
The holistic view, what we are saying, holistic
Yes.
View, but that has become a rare phenomena in allopathic science.
Now are the days where there will be a sort of a symbiosis between the modern medicine and other system. Incidentally, I will just take 1 minute.
Surely.
Last week there was a workshop which is conducted by psychiatrist and endocrinologist. The concept or the system is called as mind-body medicine, where they really, the endocrinologist, the psychiatrist, they are sharing that along with that there is something else which is required. And that is why they are definitely asking other systems to see if they can chip in. And there are very good endocrinologists, there are very good psychiatrists. And actually, the base is in United States, in Harvard Medical School. There are doctors who are recommending this mind-body medicine. So this is something upcoming, which is a very positive thing, where different systems can come together for the benefit of a mankind.
Personally, I meet probably 30 children in their teens 4 times a year coming from Mumbai. And I'm seeing a lot of depression in these children. And no one seems to be helping them except through yoga to some extent. How do you approach it in homeopathy?
See, in case you're asking me about Mumbai, in Mumbai now, in the outskirts of Mumbai at Palghar, our trust has a very good psychiatry department. And they are conducting lots of camps in the community, and that area is dominated by Adivasi community. So they are making this community aware of what the mental health is and in what way they should be helped with counseling and with treatment also. So our trust is doing a lot of work at that level. And psychiatry department is a special department. MD psychiatry means MD psychiatry in homeopathic medicine.
Combination.
Yeah.
Wonderful.
So I think the things will work out if we come together.
Dr. Shirish, thank you so much.
Okay. Thanks a lot for giving me opportunity.
Namaste. All. Namaste.